Welcome to Beating Cancer Daily. Beating stage 4 cancer for 30 years still takes my breath away every time I say it. I'm Saranne, founder of the Comedy Cures Foundation, and I hope you'll join me for just a few minutes daily for the next 365 days so we may laugh, learn, maybe cry a little as we live our best days beating cancer daily together. I just think funny thoughts, and sometimes I say them out loud about healthcare, and sometimes I refrain because I'm like, I wonder if anybody else is going to think this is funny. I wonder if they're going to be taken aback by the fact that I think healthcare issues could be funny. And it's not that I'm laughing at a person, it's that the way it's described is funny to me, or the name of it's funny. And when you have something that has so many things colliding that go wrong, when you're trying to think about comedy, that's like comedy gold. So I'm not going to tell you what my mind conjured up yet. I'm just going to tell you what Jacqui Bryan and I are going to be discussing today, because it involves a lot of different things. And to keep it straight, my mind thinks humorously. So let me introduce back to Beating Cancer Daily for over 140 episodes, our functional medicine expert, whole health educator, certified health coach, RN, just a functional medicine wizard, Jacqui Bryan.
A wizard. I feel like
You're
I've been
a
promoted.
wizard. No, because this is complicated, what we're going to talk about today. And the fact that you can have great impact on it and reverse it is exhilarating, Jacqui. So I think that talking about metabolic syndrome and showing people how to reverse it is wizardry.
Well, thank you. I need a wand.
I'm going to get you a
I want a
wand.
wand,
I
a real wand, so I can be an official wizard. Metabolic syndrome, and I am so excited to talk about it and explain it because there's a lot of confusion around it. And one of the things that's really interesting to me is that it's incredibly common in the United States. 1 out of 3 adults have metabolic syndrome. And a lot of times they're not hearing about it from their doctor. And the reason for that is metabolic syndrome is not a single disease. It's a cluster of 5 interconnected conditions that, when they show up together, dramatically raise your risk of getting type 2 diabetes, heart disease, stroke, and even certain cancers. Now, the reason we're talking about it on our Beating Cancer Daily podcast is that sometimes when we have certain cancer treatments, or we're put into menopause early, or, where our moods are affected, this significantly impacts our body shape, the way our body processes glucose, the way our gut behaves. This is a syndrome or condition that we should talk about because cancer patients are at risk.
I'm trying to process that you said 1 in 3 Americans. How is that possible?
Well, I think part of it is we are not aware of all the people that have it, number one, which is even scarier. That statistic could be even higher. But also because it's misunderstood. I mean, when we think about metabolic syndrome, and I'm going to give you kind of the categories or the conditions that are included in this syndrome. But if you think about it as your body sending up a series of flares, not all at once, but signaling that something is underlying, something's actually going on inside of the body. So what are the conditions that are a part of metabolic syndrome? Well, the first is a large waist circumference, more than 40 inches for men, more than 35 inches for women. And this isn't about aesthetics. It's not about looking lean and fit. It's actually about the visceral fat that's actually in there. And that fat wraps around your internal vital organs and leads to more inflammation, inflammatory signals that can drive cardiovascular disease. So that's pretty concerning. So that's one of the conditions that are in metabolic syndrome.
Jacqui, 35 inches is not an extraordinary amount of inches. So to think about that, that's, you know, after you have a baby and you're losing baby weight, you're coming down, you're passing through that number. I'm shocked. I thought you were going to say a much higher number. So that really
No.
got my attention.
Yeah, and in order to be diagnosed with metabolic syndrome or sort of being labeled as having metabolic syndrome, you have to have three out of the five that I'm talking about today. So the large waist circumference was the first, 40 inches for men, 35 for women. High triglycerides, 150 milligrams per deciliter or higher. Elevated triglycerides usually means that your body is struggling to process carbohydrates and sugars properly. It also is an indicator that you've got a lot of circulating fats happening in your body. So that's the second one. The third is a low HDL, below 40 in men and below 50 in women. HDL is our helper cholesterol. It's our good cholesterol. And we've talked about cholesterol on our podcasts in the past, but the HDL is actually the cholesterol that helps clear artery clogging debris. So when it's low, that cleanup crew that's in your vessels is not doing its job. It's compromised, which means things are going to build up.
I'm sitting here trying to remember my cholesterol scores. I think everybody listening is trying to remember their cholesterol scores right now and guesstimate what their waist size is if they're not in their normal, jeans. That's how I judge. I go in the closet and I have skinny jeans, regular jeans, and my heavy jeans. And I know based on which jeans I can fit into whether or not I'm doing a good job.
Right. Lifestyle matters with these, right? So we talked about large waist circumference. We talked about high triglycerides. We talked about low HDLs. The fourth on that list is high blood pressure. If your blood pressure is 130 over 85 or higher, that means that the arteries are under too much strain and it could be setting the stage for a heart attack or stroke over time. And I think about all of the changes that my body went through when I was diagnosed at the age of 37 with an aggressive form of breast cancer. I was thinking about, going into early menopause, all the medications that they put on, all the emotions that went into that. And, I remember they put me on tamoxifen and they said, "Oh, you're going to gain weight on this." So it was a battle to be able to keep my body in the best shape possible while navigating this journey in treatment for breast cancer.
So, Jacqui, just in terms of some humor, there's a funny line about low HDL cholesterol, and it says, my HDL cholesterol was so low, it was basically being polite.
Oh, that's cute. That is very cute. That is very cute. I think you can find humor in all of these conditions, but what I find to be inspiring or even exciting is that they can be reversible, especially this fifth one, which is elevated fasting blood sugar. And that's 100 milligrams per a deciliter or higher. And this is where insulin resistance starts to set in, and that's where the real numbers show up. So, just a quick review of the five conditions that are under metabolic syndrome. Remember, you have to have three or more of these to be sort of labeled with metabolic syndrome. And yes, it is true. Your doctor may not have said you have metabolic syndrome. But if you have a large waist circumference, high triglycerides, low HDLs, high blood pressure, elevated fasting blood sugar, you could be somebody that falls into that category. And why is this important to know? Well, it's important to know because this is a condition that can lead to damages of your vessels, problems with diabetes later on, heart attack, all of those. And it's actually rooted in insulin resistance. So insulin resistance is one of the driving forces of metabolic syndrome.
Oh, there's an acronym that I like. It's called COLD H. Central obesity, low HDL, diabetes, high sugar, elevated blood pressure, high triglycerides. Code H. Does that help us
Yes.
remember it?
Yeah, yeah. I mean, it's interesting because when I'm working with individuals, I'm often thinking of these five things in the back of my mind because we want to do whatever we can to reduce the risk factors, right? So if we know that insulin resistance is the root cause of metabolic syndrome, then it probably is helpful to understand what insulin resistance is. And so here's kind of how it works, right? You eat something, your blood sugar goes up, your pancreas, which is an endocrine organ, releases insulin, and that acts like the key that unlocks the cells so that they could absorb glucose for energy. And when this is working really well, you are feeling pretty good. Your energy is good, you're sleeping well, all of the above. But when you eat too many refined carbohydrates and sugars over time, your cells get overwhelmed and they start responding less efficiently to insulin signals. And that's where we get the name insulin resistance. This is where your pancreas compensates by overproducing more insulin. And for a while, that actually works. But over time, the pancreas kind of struggles to keep up. It kind of poops out, so to speak. And the blood sugar starts to climb, and the excess insulin itself becomes part of the problem, and it leads to more fat storage, increase in triglycerides, it suppresses those HDLs, and it stresses the vessels with high blood pressure, things like that. But I get excited, as I shared earlier, because this is not a permanent condition. This is, especially if it's caught early enough, it is a state, a physiological state that responds really powerfully to lifestyle change. And that's where we're going next.
I love the fact that we can be empowered to make change and that there isn't a rush to do 100 different pills, that we can actually empower ourselves to impact this and get rid of it.
Yes. I mean, that's what we're doing in our podcast, right? We're really focusing in on how to get back in the driver's seat, how to take control back. And because this is a condition that affects many cancer survivors, either after their cancer journey, during their cancer journey, this is important for us to talk about. And so let's talk about the different pillars, right? So we have nutrition, we have movement, we have sleep and stress, right? So if we start with nutrition, we want to think about the fact that food matters. It's one of the most powerful things that you can do to improve your situation. So reducing glucose flood. Right. I like kind of wording it that way. Glucose being sugar. So the single biggest dietary driver of insulin resistance is that high intake of refined carbohydrates and added sugars, those white breads, the sugary drinks, the pastries, the white rice, the processed snacks. These foods are going to spike your blood sugar really fast and really hard. And what works better for your system, and you're going to guess what I'm going to say, are the whole food carbohydrates, the vegetables, the legumes, the nuts, the seeds, the whole grains, the low glycemic fruits. These are foods that come with fiber, they slow glucose absorption, and they can blunt those blood sugar spikes, right? We want to reduce inflammation in the body, and managing blood sugar is one of the most important things that we can do.
Jacqui, I'm disappointed you didn't say the balanced diet, a cookie in each hand.
I did not say that on purpose. I did not.
I thought that's the advice. Just have one in each hand. We're good.
Yeah, yeah.
All right. I'll
We
follow yours. I'll follow yours. No, but it's easy because you've done so many podcasts on great nutritional tips that if you decide that you want to tackle this first through nutrition, just go back and listen to each of Jacqui's episodes on eating for your immune system, eating for low spikes of your blood sugar. There are so many. You've given us such a gift, Jacqui. Thank you.
Well, I think this is important. Education and knowledge is power. And one of the things we talked about in our podcast, The Strength Thief, which was talking about age-related muscle loss, was prioritizing protein. And so I'm saying the same thing here for metabolic syndrome. Protein is your metabolic friend. It's satiating, it has minimal impact on blood sugar, it supports muscle mass. And this matters incredibly here because your muscle is your largest glucose sink. It is so important when it comes to managing glucose. And so, consuming things like eggs, fish, poultry, legumes, Greek yogurt, cottage cheese, plant-based yogurts, all of those are going to be really helpful when it comes to managing your blood sugar and even fat, right? So there's some fat in the protein, but you want to choose fat wisely. Things like olive oil, avocados, nuts, seeds, fatty fish, those aren't going to spike your insulin and they're going to support the HDL. Remember, low HDL is one of those conditions that fall under the metabolic syndrome umbrella. So omega-3 fatty acids that are from your fatty fish like salmon and mackerel and sardines, those are going to reduce triglycerides. Remember, we want to keep triglycerides below 150, and it's going to help lower inflammation. So again, these are going to be powerful foods for your metabolic health.
But you're not talking about beefing up on protein powders. And I bring this up because there's a really cute joke that I want to say, but I do think it's in our quick fix mentality to just run and get a protein powder. And I know that's not what you're saying, Jacqui, but I just wanted to say this joke. Why did the person with metabolic syndrome rush out and buy protein powder?
I don't know why.
Because he thought there was no other way.
Oh, whey protein powder. There's all different kinds of protein powders. That's so funny. That is very, very cute.
Well, if you don't speak English as your first language, there's a double entendre there of the protein whey, which is spelled one way, and whey as an option. So, and then there's whey as weight. But that was just, I thought that was funny.
That's very cute. And there is a place for protein powders. So I didn't mention it, but it can be used, but I actually prefer whole food because protein powders actually fall into a supplement category. It's a little bit different than whole foods, but it doesn't mean that they're bad. It just means that, you can definitely weave them in if you want, but I do think whole foods are the better way to go.
And we didn't say it on this episode, but we always say it about eating the rainbow. Just remember, Jacqui advises 9 to 13 colors if you can get that in a day. And there are things that count as two of the colors, like an apple. The outer
Yes.
skin and the inner part literally make up two colors. So it's not as daunting as you think. And it's fun to give yourself that personal challenge every day to try to eat 9 to 13. I don't always succeed, but it gives me something to aim at.
I know. I think it's so important to have those personal goals. One thing that I found interesting in researching metabolic syndrome is meal timing and structure. So there is research on time restricted eating that can show real benefits for insulin sensitivity, triglycerides, blood pressure, and giving your body just a break overnight, finishing dinner by 7 or 8 and not eating again until, 6, 7, or 8, that can be something that can support metabolic rest and repair, which is so, so important.
I just
And
want to butt in for a second, Jacqui, and say if you didn't hear that properly, she wasn't saying restrict eating in the sense of, you know, anorexia. She's literally just talking about timing overnight. And we did a whole episode on, what's the right amount of time. Sometimes people take it too far and they do not pick back up on meals during their meal times. So there's a whole episode on how to do this timed eating. Just know that we're not saying don't stop eating. You just make it time sequenced.
right, right. And that's something that will just give your body a little bit of break from food. And again, like Saranne said, it's not full on fasting for days. It's just maybe a 12-hour window. That's what I do. I usually have my last meal by 6 and then I'll have breakfast by 6 or 6:30. That kind of works for my lifestyle, but it's important to find what works for you. One of the biggest questions I get from people is, what's the right diet for metabolic syndrome? And so the evidence-based dietary pattern that has received the most attention is the Mediterranean diet. Study after study links the Mediterranean diet to reduced risk of all five metabolic syndrome markers that we just talked about, which is so exciting. And that's because the Mediterranean diet emphasizes vegetables and legumes, whole grains, fish, olive oil, and nuts. It's sustainable, it's enjoyable, there's super fun recipes for it. So I think it's something for people to explore to reduce their risk for metabolic syndrome.
Jacqui, I thought you were going to say we have to all go to the Mediterranean. That's how we fix
Field
metabolic
trip.
syndrome. Yes, this is a Beating Cancer Daily field trip. We have listeners all throughout the Mediterranean. We should just get on a plane, go eat the food there, watch how beautiful the sunsets are, walk a lot, swim. I think we'd all be cured of cancer, cured of
I
metabolic
think so.
syndrome.
I think so too. It's funny because that segue, Saranne, is perfect going into the next pillar of preventing metabolic syndrome, and that's exercise. Exercise is one of the most powerful metabolic interventions that exists. If I could bottle it and put it in a pill, it would be a bestseller. And the reason for that is when your muscles contract during exercise, they pull that glucose out of the blood through a mechanism that doesn't even require insulin, right? So it kind of gives that pancreas a break. And exercise is essentially an insulin bypass, and it improves insulin sensitivity, both in short term and even for hours after exercise. So the long-term benefit is something that is going to be incredibly helpful for preventing this condition. And so what kind of exercise matters? Well, all of it does, right? So aerobic exercise, you're walking, jogging, cycling, and swimming. That is something that will directly reduce that visceral fat. Remember that waist circumference of 40 for men, 35 for women are the risk factor, right? So just moving is going to help reduce that waist circumference, the triglycerides, it's going to raise HDLs, and even just 150 minutes of moderate intensity exercise per a week, not a day, produces significant improvements. And so that walk you were just talking about will make a difference.
I was listening to this interesting story about exercise in Japan, and gym memberships like aren't a big thing according to the report. It said they really emphasize walking in their culture. And so just thinking about when can we walk more? So I really have been conscious about, can I walk further? Like if we have to drive to the mall, not park right at the entrance, but park in an outward place and then walk further to get in instead of just running in and grabbing the one thing I need. Maybe walk a few laps, take the stairs instead of the escalator, because I realize now I'm walking so much less than I ever did before.
Well, it's also because we're so busy, right? I mean, it's also because we're just not making the time for it. And prioritizing walking is just so incredibly important. As we talked, that's more aerobic exercise, but even resistance training, right? That's something that I struggle with. Like I will do it a couple times a week, and that includes weights, body weight exercises, bands, and that builds and preserves your muscle mass. And that is your glucose disposal system. That muscle is so important. 2 to 3 sessions a week will improve the insulin sensitivity. And even just taking little walks after you eat, just like you were suggesting, can actually help us reduce our blood sugar and make it easier on our pancreas, right? It's all about finding ways that you can move a little bit more each day. It doesn't have to be overly stressful. We just have to weave it into our routine if possible.
I do this little trick when anytime little hand weights are on sale, I buy them and then I station them all over the house. It's really bizarre, but I see them. It triggers for me. Pick up those weights because I don't go to the gym. And just while you're talking on the phone, if I have an earpiece in, I'll just do some reps just to get them in as I'm near that little hand weight section that I have them stashed in. It's helping. It's
It's
definitely
brilliant.
helping.
It's brilliant, Saran. And I think that's such wonderful advice for our listeners because I don't want them to feel like they have to go to the gym or get the barbells. They just need to weave in little extra activity. But but what about sleep? Sleep and stress are the last pillar I was going to talk about. And I think it's probably the most overlooked factors, right? When people are trying to change their lifestyle, they think, what am I going to eat? How am I going to move? They don't think necessarily about sleep and stress. And, that nutrition and exercise, they do get the most attention, but sleep and stress are just equally as important. So poor sleep, or not sleeping long enough, less than 7 hours per night, is directly linked to insulin resistance because you have increased cravings for carby foods. You have elevated cortisol, which is your stress hormone. You have higher triglycerides and even increased visceral fat. 1 week of sleeping 5 to 6 hours has been shown in research to measurably impair insulin sensitivity. 1 week. I don't know about you, but when I got diagnosed with cancer, I did not sleep for like a month. I was so stressed. I mean, sleep is your metabolic medicine. And so we need to prioritize 7 to 9 hours a night if possible, be consistent, have consistent wake times and sleep times, even on the weekends. Sleep in a cool, dark room, limit that screen time, and keep alcohol either out of your diet or just make sure you really limit it, especially before bed. Those are some good suggestions for sleep.
I am trying. I really am trying to get so much better at my sleep hygiene. But I can tell you, if I don't get at least double the amount of sleep that I've admitted on this podcast that I do, I wake up and I am bloated and I see
Oh,
that
good point.
bloat for the
Yeah.
rest of the day. So my stomach does not lie. When I sleep a little, I look like I'm 3 months pregnant. And when I sleep more, I have more of a flat stomach. But Jacqui, I see it now. And that was never the case when I was young. I never showed that. And as I am getting older, it just appears.
I think that's so interesting. So the next time I see you, if you're looking a little puffy, I'm going to know
It's not a
that you
little
did not.
puffy. This is serious. No, it really is. I just
Well,
see it now.
Well, what's interesting, Saren, is lack of sleep is something that is a stressor on the body. And if you're not sleeping consistently well, that will fall into more of a chronic stress situation. So, long-term insomnia is chronic stress on the body, long-term financial issues, serious work pressure, relationship strains, caregiving demands, all of these things are
Are you
going
reading
to
my diary? No, I'm just kidding.
all of these
I
are
couldn't
things that
resist that joke. I'm sorry. It just sounded like funny in my head.
no, it's funny and it's good to laugh about it because especially since that's going to help reduce cortisol, but that chronic stress is going to pump cortisol, which is your stress hormone, all throughout your body, which increases inflammation and can drive insulin resistance, promotes abdominal fat storage, raises blood pressure, and it can even lower HDL. I mean, one of the things that happens when I'm working with an individual is trying to lose weight and they tell me, "Oh, all the fat is in my belly." I immediately start thinking about cortisol. I think about how stressed is this person? You can't ignore chronic stress. Chronic stress is something that needs to be addressed with mindfulness, maybe meditation, deep breathing. Physical movement can help metabolize stress hormones, but running all the time without having decompression time isn't going to work. You have to find some downtime to be able to nourish and support your body. And that might include working with a therapist to directly address your health goals, right? It is a priority for health for sure.
We have hundreds of episodes, Jacqui, on beating cancer daily with tricks and strategies for reducing stress, for improving your sleep, just your overall well being. So, if you're just starting with us, I hope you go back and listen to the hundreds of episodes because it is a masterclass in all the things that Jacqui has discussed. And just in terms of really working towards this goal of getting rid of metabolic syndrome, there's a great episode on habit stacking of how you could start slowly and work yourself through this if you don't want to go to a professional like Jacqui. Jacqui, there was a great cartoon with a doctor, and he's talking to this patient, and it says, I'm afraid all that worrying about what's healthy to eat and drink has set your cortisol levels sky high. So we're not trying to freak you out or worry you. Information is power. Hopefully, you will take this and just talk to your doctor about it. We're a story starter. See if you do have metabolic syndrome. You can think through, do you think three of these five symptoms may be where you are? It's definitely worth the conversation.
Well, and I have some questions to ask your doctor, right? So the interesting thing is you might be hearing this podcast and think, like Saranne said, you have three out of those five. What do you do with that information? Well, just what Saranne said, you go to the doctor and you can ask the doctor, do I have metabolic syndrome? Am I showing early signs of it? Being direct rather than just waiting for your provider to bring it up is key. Or you could go to your provider and say, hey, would it be okay with you if we look at the five metabolic risk factors while I'm here? You've got to remember that the doctor has a lot of patients. They might not be looking at all of these criteria as a whole. And so that would be really interesting thing to do. If you don't have all the data, maybe you need your blood pressure checked or your fasting blood sugar or triglycerides or your waist circumference done. I've never had my waist circumference measured at the doctor's office. So I think that's a really interesting thing to do. Or you could even go in and say, this is what my waist circumference is. Can you check these other numbers? And even asking what your actual numbers are, what they mean. And you can even talk into with your provider. Because again, there are partners in your care. You can say, given my age, my family history, my background, am I at higher risk? And then ask them what lifestyle changes would make the biggest difference. Now, sometimes there are healthcare providers that are really dialed into lifestyle behaviors, and then there are other practitioners that aren't, and they might want to give you a pill for something, or, and that's up to you whether you take it or not. And again, that's part of the conversation. But also know that metabolic syndrome is a lifestyle condition. And what that means is it can be significantly impacted by lifestyle, cutting out the sugar, walking after meals, adding proteins to your breakfast, lunch, and dinners, and then protecting your sleep, prioritizing it.
I learned so much, Jacqui. Thank you for coming on to Beating Cancer Daily and being such a resource of factual information, science-backed information. There's so much sensationalism out there and fake news, and you just always come with these gems. So I just want to be grateful for you doing all these episodes with us, and I can't wait till the next one. Thanks, Jack.
Thank you, Saranne. So until we meet again, let's eat well, move your body, sleep like it's your job, and be kind to yourself and manage your stress. Those small steps are going to add up. Thanks for having me today.
And I'm going to add laugh more. Find the funny because it does wonderful things for your mind, body, and spirit. If you want to learn more about Jacqui Bryan, you can go to JacquiBryan.com. If you can't find her or you want to laugh more, come to me at the Comedy Cures Foundation, comedycures.org. And if you want to tell us what you're doing to improve in all these areas, you have some ideas for us too. You can share them at comedycures.org. You can hit the record button in the podcast area or go to the contact menu and just write to us. We love to hear from you. Have a blessed day, and I'll see you tomorrow. If you loved today's episode, then tell the world. Why? Because Beating Cancer Daily is a listener and donor supported experience. So the more people you tell and the more people that join us, the more robust and interesting programs our nonprofit, the Comedy Cures Foundation, can bring to you throughout the year. So if you have some extra change, I'd love you to go to comedycures.org and make a donation today of whatever level is comfortable for you. It will be tax deductible to the extent allowed by law because Comedy Cures is a nonprofit 501c3 organization founded from my chemo chair, April 1999, and we've been going strong ever since. So please consider making a donation today and help our community and this podcast thrive. Guess what time it is? It's time for me to read the disclaimer. Beating Cancer Daily and the membership circle are not in lieu of medical advice or treatment. They are for entertainment purposes only. Please consult your healthcare team to review your best strategy. Thanks for listening. See you guys tomorrow.